Hello nurses, this is Kevin with Nursing KAMP.com, and these are my scribble notes on nursing in the NCLEX. This is cardiac lecture number 33, Hemodynamics, Labs, and Heart Failure, to pave the way. Alright, follow from my sticky note on heart failure, which covers all this content area. Alright, they can be found on social media named Nursing KAMP and nursingkamp.com, so let's get going. All right, so the first thing we're going to look at is with heart failure is that we talked about the structure. Now, heart failure structure is that the heart, there's something wrong with it. No kidding. The heart is in failure. And that principle is that with labs specifically, when there is a blood, and we talked about this in the previous lecture, where 55% plasma is the fluid portion and 45% is your formed elements. Now, the fluid portion is the problem because the heart isn't really pumping because of a damage or the valves or, the structures change. They have cardiomyopathy where they get a floppy heart, or they have hypertrophy in the heart, muscles too thick. So whatever the reason is for this CHF or this problem with the heart pumping, it's about cardiac output. There's decreased cardiac output. And we say cardiac output is a hemodynamic, right? So cardiac output is, we put it 0 there, and that becomes 8. And half of 8 is 4. So cardiac output is 4 to 8 liters per minute. All right, so hemodynamics are very important because if it's less than 4, the patient will have signs and symptoms of heart failure, CHF. And what are those signs and symptoms? Well, the issue is back to this fluid, this 55%. If the heart isn't pumping, it can't maintain with the kidneys perfusion and to get urinary output. That's supposed to be a toilet, whatever. And you can't maintain it because the cardiac output over here isn't enough. It's decreased. Well, that also is evidenced by the ejection fraction, EF, ejection fraction, which you find from an echocardiogram. And what they do is they measure this portion. And they measure how much of the cup is ejected. Okay? And that needs to be greater than 65%. If it is greater than 65%, they're good to go. If it is less than 65%, they will have symptoms of either right-sided or left-sided heart failure. And that makes that acute. That's why the ejection fraction from an echo is pivotal in understanding whether or not your patient will be having CHF symptoms or not. And Lasix, it deals with the fluid portion. And in the previous lecture, we talked about the fluid building up because of decreased cardiac output. And that volume is the ejection fraction. It can't pump out enough because the tissue, the damage is heart failure. All right, so what happens? Well, the brain, the brain needs perfusion, okay? And in order to have perfusion, we need a mean arterial pressure. And that mean arterial pressure needs to be greater than 65. Well, that's also similar to this ejection fraction. Well, the funny thing is with the brain, it needs to be greater than 75, 70 to 75. Then that person's getting perfused. But if it's less than this mean arterial pressure, or it's the result of a poor ejection fraction and decreased cardiac output, the person gets restless. That's why decreased level of consciousness is always acute. And the mean arterial pressure is important. Well, the first thing that happens with the brain is the brain says, hey, wait a second here. I'm not getting any perfusion. So it basically says, hey, heart, what's going on down at the heart? And because the body wants to survive, the heart is pumping as hard as it can. And what happens is it starts to stretch and have problems. And what happens is the brain says, wait a second here. Why am I not getting perfused? And it says, well, I'm going to secrete some BNP, some brain natriuretic peptide. Please see my lecture on BNP. But BNP gets secreted to help pump the heart. So the brain kind of says, hey, you're a failure heart. You're not doing any work now. I'm going to secrete this because I need perfusion. And what happens is that it secretes BNP, the heart is stretched, and then what happens is you start to get an increase in cardiac output, contractility. And what happens is you also see an elevation in BNP in the bloodstream. Well, that only works for so long, though. That's the problem with BNP. It's a good indicator. It's a good indicator that there's CHF going on. So that's why it becomes one of the diagnostic labs for CHF. So when a patient has CHF, what we do is we draw a BNP. And the reason we draw that BNP is because if they're in failure, the heart's not working. So the brain's secreting this BNP so that we can increase cardiac output. And because the cardiac output is not enough. All right, so elevations of BNP greater than 100 or 150 is positive for CHF. There is some speculation about, like, over time the body, it's kind of like a Cry-Wolf syndrome. Like, if the heart is damaged, the heart is damaged. And what happens is over time, the body says, I'm not producing any more BNP, but they could still be in CHF. It just doesn't work anymore. So that's kind of what happens with that. So some other hemodynamics. How do we know they're full of fluid? Well, we talked about cardiac output, CL 4 to 8, right? So CVP is 1. That's also 4 to 8. 8 is too much fluid. So a person with CVP is like this, okay? So they're really filled with fluid, okay? So greater than 8. And then we also have PAWP. And what that means is their lungs are filled, okay? This is too much water. So that's also, no, that's wrong. 8 to 12. Oh, yeah, so greater than 12 is too much fluid. All right, and that's CVP. That's wedge pressure. This is your wedge pressure. Please see my lecture on wedge pressure and CVP where I break those down a little bit closely. But these are fluid hemodynamics, and that's very important to evaluate. And so what if I don't have a CVP or a wedge pressure? I would also have JVD. So JVD greater than 4 is too much fluid. That's like a CVP greater than 8 or wedge pressure greater than 12. And what does the patient look like? But we're not really talking about that. We're talking about hemodynamics specifically and labs associated with heart failure. So these hemodynamics, cardiac output, CVP, wedge pressure, and JVD are all signs and symptoms of heart failure hemodynamics and labs. And the BNP is specific to heart failure. So in NCLEX questions, when you're evaluating heart failure, elevations in BNP means they have CHF. Well, that's about it. My name is Kamp, and this is Nursing Kamp. You can find me on social media, Instagram, Facebook, Pinterest, and Etsy, and also on nursingkamp.com. We'll see you next time. Nurse on.